So there are a lot of things that we as medical professionals call babies who are born early. You're going to hear terms like late preterm, early term. You're going to hear things like micropreemie, very low birth weight, extremely low birth weight, low birth weight, and they all have slightly different meanings. If your baby is born late preterm, that just means your baby's born between 34 weeks of completed gestation and 36 weeks of completed gestation. They haven't made it quite to completing 37 weeks of gestation. And we know from looking at many babies in that late preterm range that sometimes they need a little bit of extra help. And so that's what we do. And we kind of let the baby show us how much help that they need, and that's how much we give them. There's no mandatory, you have to come to the NICU because you're late preterm. But you will find that most nurses and doctors will look at your baby a little bit more closely, and they will see whether your baby is doing the things that the baby ought to do to be able to come home. And so your nurse is going to talk to you about how your baby's keeping its temperature up. Your nurse is going to talk to you about how your baby's eating and how the breastfeeding is going for you. But in fact, many late preterm babies can breastfeed just fine. Babies who are born a little bit earlier than that, we look at them in weight categories. So low birth weight is any term baby born below what we call 2,500 grams, and we think in grams in the medical world. A very low birth weight baby is born below 1,500 grams, and an extremely low birth weight baby is born below 1,000 grams. It might be that your baby is in a different week stage of pregnancy when they're born at these different stages, because you can be large or small for gestational age for where you ought to be on the curve of normal pregnancy. And there is certainly a curve of normal and a wide range of normal at different weeks of gestation. And so if you're confused by any of these terms, you should talk to your nurse, and you should ask her to explain the terms to you so that you understand any medical term that a nurse or a provider talks to you about your baby.